Emergency room nurse Jason Powell knows how easy it is for frontline staff to miss out on sleep right now.
With the amount of staff absences and the concurrent pressures with patient complexity, sleep deprivation and just being tired is just the norm, especially throughout this pandemic.
For shift workers, melatonin is a common and seemingly simple solution. A naturally occurring hormone, it regulates your sleep-wake cycles, and it can be found in pill form. A new study out this week reveals in the U.S., use of the over-the-counter supplement is increasing. But unlike prescription drugs, melatonin is considered a natural product by both the U.S. FDA and Health Canada, and therefore not fully regulated. Researchers have found the pills may not contain the amount of melatonin advertised on the label.
Some of them only had a quarter of what they said they had, and others had 5 times as much. And some of them also had other contaminants in them. So it's unfortunately very difficult to get a good, reliable supply.
At this Calgary clinic, experts have noticed an increase in the amount of people struggling with sleep. Jonathan Charret says more time spent in front of a screen is likely to blame.
If you are blasting your brain with light, such as blue light, you will reduce the secretion of melatonin.
But he says supplementing melatonin is almost never the answer.
Most people use it incorrectly. And then when it doesn't work, you will either increase the dose or you will couple it with something else.
Instead, experts suggest shutting off any screens at least 30 minutes before heading to bed and making sure your sleep space is quiet and dark. If that isn't working, it's time to consult a professional.
The last thing that we want is our own sleep deprivation and our own lack of personal, physical, and mental health to translate into an unsafe work environment.
Focusing on personal health in order to care for others' health. Jamie Mauracher, Global News, Toronto.